Hello everyone. Welcome to Lify Life, Vascular Asterisks on the legs. Is it worth panicking and how to get rid of the problem? A common reason for patients to visit a phlebologist, especially women, is the aesthetic discomfort from multiple dilated vessels and capillaries of the skin on the legs. The so-called spider veins is a very common problem, because, according to statistics, almost every second woman has such dilated vessels on her legs. Should I panic and how to get rid of the problem, says phlebologist, vascular surgeon. What is telangiectasia? Telangiectasia is a permanent, most often progressive expansion of small vessels of the skin of a non-inflammatory nature. Outwardly, they appear as vessels of red, blue or crimson color, depending on the preference for the venous or arterial component. These are very dilated capillaries that are 5 times larger, half a millimeter to 1 millimeter, in diameter than their normal counterparts, which are usually not visualized. In Western practice, they are better known as spider veins, because of the characteristic appearance. Usually you can easily see such vessels, but they do not protrude out of the skin like large varicose veins. At first simple or linear, red or blue capillaries appear, which increase over time, forming already meshes or a network of small vessels. With progression, a network of blue and purple large veins appears, forming clusters or so-called clusters. Telangiectasia is located in several layers of the skin. A certain feature of vascular defects on the legs is the presence of not only small capillary formations, but also reticular veins, Latin reticulum, mesh. These are intradermal veins with a diameter of 1 to 3 millimeters, which are located deeper than telangiectasias. Most often they are nutrient veins for telangiectasias. In other parts of the body they are observed very rarely. This is an important feature that must be taken into account when carrying out phlebological procedures, since these vessels are interconnected. When removing dilated veins on the legs, you must first close the nutrient, central, vein, and then the capillaries, because without this it is impossible to achieve a full-fledged positive cosmetic result. The most common localization of telangiectasias on the legs is the outer surface of the middle third of the thigh, around the knee and ankle joint, on the inner surface of the legs, very often in the popliteal area in women, given the anatomical structure of this zone. A separate type of dilated vessels on the foot is called the phlebectatic crown, corona phlebectatica, which is classified as complicated venous insufficiency. A feature of vascular defects in the legs is their anatomy and physiology, especially the regulation and redistribution of pressure in the venous system in order to properly return venous blood to the heart. Considering that we are in a vertical state most of our lives, there is a very high pressure in these small capillaries in the legs. Therefore, the professional training of a phlebologist who understands all these features is a guarantee of achieving the result expected by the patient. Should telangiectasia of the lower extremities be considered a vascular pathology or is it a purely cosmetic defect? Until recently, there was no clear answer to this question. In 1996, the international phlebological community classified telangiectasia and reticular veins as Class I of the International Classification of Chronic Pathology of the Veins of the Lower Extremities. This means that they play a role in the development of chronic venous insufficiency. So, telangiectasia is the ultimate chronic pathology of the veins of the lower extremities, which determines the need for its correction. According to modern medical concepts, dilated skin vessels are not a disease, do not affect health and do not have a significant impact on life, they are only a cosmetic problem. Despite this, with a careful and professional history taking, most people with telangiectasias can identify specific complaints that are characteristic of venous pathology. Such patients note a decrease in tolerance to static loads, sleep disturbance and increased irritability, Nocturnal cramps in the calf muscles associated with the initial manifestations of chronic venous insufficiency. Complaints and their frequency are manifested as follows. Cosmetic defect -100%. Burning sensations -74%. Paresthesia, sensation of warmth, and crawling -57%. Tingling, pain -38%. Spontaneous hematomas -27%. Itching -11%. In most cases, there is a combination of different complaints. In particular, in women, discomfort increases directly during menstruation. Thus, spider veins on the skin of the legs, in addition to an aesthetic defect, also cause physical discomfort that requires specific correction. However, telangiectasias are resistant to any method of their removal and are prone to relapse, return of the disease after complete recovery. Therefore, such vascular pathology should be treated as a cosmetic problem, and remember that over time, it may need to be repeated. Who to contact? For quite a long time, cosmetologists were engaged in the elimination of such vascular skin defects, using laser coagulation, using different types of lasers. But all this did not give the expected results and only led to dissatisfaction of patients. In parallel, phlebologists were also involved in the removal of these vessels, using microsclerotherapy, treatment with injections, which was considered more effective than laser coagulation, but also had a fairly significant proportion of pronounced side effects. The unaesthetic consequences of the microsclerotherapy procedures, which lasted for quite a long time, were also the cause of dissatisfaction of both patients and specialists. Research in the phlebological field has led to a new understanding of the structure of such vessels, their functioning, and also stimulated the modification of various methods for their elimination. So in phlebology came the allocation of a separate direction, cosmetic phlebology, using the modern achievements of science and technology. Why is this a cosmetic problem? According to the modern idea that, recognized by all international phlebological communities, telangiectasias and reticular veins localized on the lower extremities are not a disease, this is only a cosmetic defect. Only in some cases they can be directly related to impaired venous circulation. Very often, such dilated small vessels accompany varicose veins, but if there are no varicose veins on the leg, that is, dilated skin vessels are isolated, then during an ultrasound examination, no signs of circulatory disorders of large veins are found, which can lead to the development of varicose veins. That is why in almost all situations of the presence of dilated small vessels, it is necessary to do an ultrasound examination. If functional disorders in the veins are detected, they will need primary correction, because cosmetic procedures performed without eliminating the pathology will simply be ineffective and may lead to adverse events or complications. Phlebological cosmetic procedures are high-tech. The specialist who performs them must have a high profession, rich experience in various procedures, understand the capabilities of the equipment and be able to use it professionally, individually for each patient. Therefore, the most effective specialist in the elimination of cosmetic vascular skin defects is a professionally trained phlebologist who understands the features of such a pathology, can perform a thorough ultrasound examination and select a modern and effective method for correcting vascular defects. Thank you for watching. Make sure you like the video and subscribe for our new content. Click the bell sign to stay in contact with updates from us. Hope seeing you back on Lify Life.